Meanwhile, 24 people in Dunedin have been told they have cancer after getting long-awaited biopsies in a weekend superclinic run by the Southern DHB. Remember, we've been looking at this afternoon. Chief Medical Officer Dr. Nigel Millar admitted these people have waited too long and it's simply not good enough. He says if they hadn't had the superclinic, they would have had real trouble even clearing the backlog of patients in the short to medium term who've waited too long for a diagnosis and treatment.
The patients who ended up coming to the superclinic were the ones we didn't manage to deal with first. And of course, we tried to find the ones who we thought were at highest risk. But it's quite clear that we would have been a long time trying to get up with things if we hadn't had the great help and support of urologists from around the country.
So 24 people with cancer would have waited longer, and in some cases a lot longer, for diagnosis.
That would seem likely where we'd be without that additional help to catch up.
How long had they waited for the superclinic in some cases?
I can't give you the exact precise figures, but they waited longer than they should have, which is, the most important thing. It was too long, and we would greatly regret that. And it's our determination not to have this build up again or things to go this bad.
In what way is this good enough?
I don't think it is good enough. I don't think I would ever like this to be acceptable levels of care. It's below an acceptable standard, and I think we have to acknowledge that.
This is the public health system, and it's extraordinary, isn't it? I mean, what do you feel about this?
Oh, very unhappy, disappointed, sick at times that we find ourselves in this position of not been able, or actually not achieving what we ought to achieve in terms of the quality of care.
What you are saying is people have been really let down.
Yes, that's entirely correct, and I think that's the dreadful thing. A real slur on the district health board that we've let people down. Absolutely, and our first response to that obviously is to do our very best as quickly as possible to correct it for those people.
Is that enough?
And then. Well, no, and then we need to go and correct the system so it doesn't happen again.
And what do you say to those people? What do you say to the people who waited longer than they should have waited in the public health system for a cancer diagnosis?
Well, we're really sorry that the district health boards failed them and the people of Otago and Southland, that we haven't met the appropriate standards and people's care has been delayed.
Where does the buck stop for this? I know we've had these conversations before with the Southern DHB, but you are so prepared to admit fault and you are so prepared to say it isn't good enough. But the CEO is still in his job, you are still in your job, all the people involved in the urology department are still in their job, the commissioner is still in their job. In other words, there seems to me to be a disparity between the buck actually stopping anywhere and the rhetorical admission of fault.
Well, John, I don't think I count my admission of fault as rhetorical. It's real. I think we had this discussion before. You asked me, was I going to resign? And I think my answer was, well, I would if I thought that would make things better. It would improve things. We'd get it fixed quicker. I feel a responsibility to take a hand in sorting this out. It may be that somebody later says that what I've done or what somebody else has done not good enough, in which case there may be consequences. I think my focus at the moment is actually doing our best to resolve this for the people who've been affected.
Dr. Nigel Millar, who was the Chief Medical Officer for the Southern DHB.